Today I came with the important topic for all nursing exam including CHO, Aiims, Jipmer, Nimhas and other nursing entrance exam. So let's start our today's journey with the amazing quote. Okay, so every early morning you have a two choice. Either you continue with your sleep and watch your dream, or you wake up and chase them. So let's do it together and let's crack it. Okay, so let's start our today's session. Salicylates are the drug of choice for treating the rheumatoid arthritis. Salicylate contains the drugs like aspirin. Okay, so aspirin is a drug of choice to treat the rheumatoid arthritis. Okay, another question from this, that the main causative organism for a rheumatic fever and rheumatoid arthritis, it is group A beta hemolytic streptococci. Okay, group A beta hemolytic. This is a main causative organism for rheumatic fever. Okay, and other topic from this is Jones criteria. Okay, Jones criteria for a diagnosis of rheumatic fever. It includes the minor and major criteria. Minor criteria includes the symptoms like fever, increase the ESR, increase the CRP, then arthalgia. Okay, and the major criteria include carditis, then polyarthritis, then chorea, erythema marginatum and subcutaneous nodule. And we have to check for elevated the anti-sterolysin or titer. So this is the diagnostic criteria for rheumatic fever. Okay, next, burn patient need a high protein diet because it useful in a healing, and also protein are lost through the burns wound, so patient having a burns require high protein diet. Okay, next, withdrawal symptoms of alcohol is called delirium tremens, and the disulfiram drug is a drug of choice for alcohol dependency. Okay, and this drug cause the individual to suffer from a very unpleasant side effect like headache, vomiting, then tachycardia and hyperventilation. Okay, so how this drug works? So when alcohol enter in the body, it convert into acetaldehyde. Okay, alcohol convert in our body in acetaldehyde. Okay, then it convert into acetic acid. Okay, and this disulfiram drug, it blocks the conversion of acetaldehyde into acetic acid. So disulfiram drug is block the conversion. Okay, and so it increase the acetaldehyde level in our body, and acetaldehyde is a one kind of toxic substance which cause the various side effect and various symptoms. Okay, next, the richest source of vitamin D is a fish liver oil, and the natural source of vitamin D is the sunlight. Okay, next, pellagra is due to the deficiency of niacin, and niacin is a vitamin B3. Okay, so pellagra is the deficiency of niacin, and the main symptoms of a pellagra is for the symptoms of the pellagra disease is diarrhea, then dermatitis, dementia, or even in severe case it leads to a death. So these are the 4D of a pellagra disease, which is caused due to the deficiency of niacin, or we can say vitamin B3 deficiency. Okay, next, deafness is a seen with an overdose of streptomycin. Okay, so streptomycin is a drug of choice in a tuberculosis patient. Okay, so this streptomycin affect the 8th cranial nerve, which is the vestibulocochlear nerve, and it causes the ototoxicity, and in a severe case it will lead to deafness. Okay, next, chorea, also known as uveitis dance. Okay, so chorea is the type of symptoms seen in a rheumatic fever, it include in a major criteria. Okay, so chorea is characterized by a rapid, uncontrollable, uncoordinated jerking movement, primary affect the face, hands and feet, and it seems like a dance, so it also called as a st vitus dance. Okay, then next, the urea breath test is used for detect the Helicobacter pylori, H. pylori bacteria. Okay, so H. pylori bacteria is a causative organism for a peptic ulcer disease, and in this procedure you have to swallow the capsule containing the urea, and if the H. pylori is present in your stomach, then the urea is a breakdown and turn into the carbon dioxide, and then axial carbon dioxide is a measure and which commonly detect the presence of a H. pylori bacteria. Okay, next, Pomeroy technique is used in a tubectomy. Okay, so Pomeroy technique is a one kind of technique used in a tuber ligation. It is a most common technique used in a tuber ligation procedure. Okay. So here you can see the Pomeroy procedure. Firstly, we have to tie the fallopian tube, okay, by with catechate suture, and then we have to cut or excise the part. Okay, and then the final result of Pomeroy technique, it is the tubal anastomosis. Okay, so this is the Pomeroy procedure mainly used in a tubectomy or tubal ligation. Next, the most common form of childhood cancer is a leukemia. Okay, and the mainly leukemia in a child is acute lymphoblastic leukemia. Okay, this is the most leukemia in a children. Next, anti-sterility vitamin is a vitamin E. Okay, next, the basic unit of society is a family. Okay, family is the basic unit for society. Next, hematochezia is a fresh blood in a stool. Okay, so melena. So melena is a kind of black terry stool, and the hematuria is a presence of blood in a urine, and the hematemesis is a presence of blood in a vomiting, and here hematochezia is a fresh blood presence in a stool. Okay, next, the smallest cell in a human body is a sperm, and the largest cell in a human body is the ovum, and the related questions like largest artery is the aorta, and the largest vein is the inferior vena cava. Okay, and the longest vein is a saphenous vein. Then the longest bone is a femur bone, and the smallest bone is a stapes. Okay, so related question is asked in a various nursing exam. Next, rubella is also known as germal disease. Germal measles. Okay. Next, the most important aspect of a hand washing is a friction. Okay. Next, Mittelsmurd syndrome is a one-sided lower abdominal pain associated with the ovulation. So here Mittelsmurd syndrome, it is a mid-cycling pain. Okay, it mainly occur during the ovulation. Next, Kala Azar, it is a disease caused by an infection with a Leishmania parasite. Okay, so Kala Azar, it is also known as a black fever, and it usually occur due to the infection of a Leishmania parasite. Okay, next, breast milk give the passive immunity. So here immunity is the one kind of most important topic for a various nursing exam. Okay, and if you want to detailed information, then you should visit the link given in a description. Okay, I made the separate video on immunity. So here breast milk give the passive immunity. Next, one woman performed the monthly breast self-examination. It comes under the primary level of prevention. So this one is also important topic, that is a level of prevention which should ask in a various nursing exam, and I also made the separate video on the level of prevention. You should also visit. I give the link of in the description. Okay, so here level of prevention include the mainly four. These that are the primordial, primary, secondary and tertiary. Okay, primordial prevention, and that absence of risk factor. Okay, it mainly include the mass educations. Okay, then the primary level of prevention, in that the presence of risk factor, and the main goal is to minimize the risk factor by health promotion and specific protection. So specific protection like immunization, then chemoprophylactic drug, okay, and use of helmet, seat belt, use of condom, okay, these are included in a specific protection, okay. Then secondary level of prevention, it includes the early diagnosis and treatment. So various diagnoses include the including the pap smear test, then sorry, I make mistake here, please correct it, that the monthly breast self-examination, it comes under the secondary level of prevention. As I said, that the secondary level of prevention including the early diagnosis and treatment, okay. So here breast self-examination, then pap smear test for cervical cancer, that all are including in the secondary level of prevention, okay. So here please correct it, that breast self-examination include in a secondary level of prevention, and in tertiary level of prevention it include the rehabilitation procedure, like, okay. So the main goal in the tertiary level of preventions are to minimize the complication and for a better health perspective, okay. So it includes the rehabilitation procedure like vocational rehabilitation, speech therapy, okay. So these are the some important points which repeatedly asked in various nursing exam, that, okay. I hope that you get all this point, and still if you have doubt, then feel free to ask in comment box. And if you like this like our video, then please share it with your friend and subscribe to our YouTube channel. Thank you for watching.